Hola, ¿qué tal amigos? Soy Ben Crafty.
¿Qué tal amigos? Te saluda Funky.
¿Qué tal amigos? Le habla su hermano Michael Rodríguez.
Hola, ¿cómo estás? Te saluda Marcos Vidal desde España.
Hola, les habla Marcos Witt.
Hola, soy Ingrid Rosario.
Hola amigos, les habla Harold Guerra.
Todos ellos, sus mejores canciones y muchos más hacen parte de la programación de Aliento Radio. Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial. Aliento Radio Oficial.
Welcome to another show of Avatar Home Health and Hospice. We were trying to bring you information about the services that we provide, and with it today we're gonna just talk about hospice services, which is something that is very misunderstood. However, before I get into that subject, I would like to give you a brief history and explanation of what we do at Avatar Home Health and Hospice. So back in 2005, my daughter, who's a registered nurse, and myself and my wife, we decided to start doing or establishing a home health agency. At that time, we started with home health and caretaker services. And in 2010, we added hospice services. And basically, the main reason that we added hospice services was because our home health patients and our caretaker patients, when they need a hospice, they will go to another agency. And that really created an issue with our patients that were used to their caretakers with us, their avatar caretakers, and then all of a sudden, they will have to go to complete strangers and start the process all over again. And hospice is not the right time to do that. So we started hospice around 2010, and at that time, it was a young agency. I think that we had about 100 patients or so, and we've been very blessed. Over the last 20 years or so, we've grown from 0 patients and 3 employees to about 500 patients in all our services. That includes home health, hospice, and caretaker services. And from three employees to right now, we employ approximately 150 professionals. So among those professionals, we have nurses, nurses assistants, therapists, occupational therapists, all kinds of therapy, occupational, physical, speech therapists, doctors and chaplains and social workers and caretakers, and of course, an office staff to support those people that are doing the hard work out in the field. So let's talk about hospice. Hospice is a bit misunderstood, and that's I'm not really being honest. It's actually very few people understand what hospice services are, and some of those people that do not understand what hospice is our doctors. So when we go in a situation with hospice patients, sometimes we find ourselves where the patient sometimes don't even know that they've been referred to a hospice agency, and they have no idea why or what is entailed in the hospice services. So hospice services, unlike home health, are for the patients that have a terminal illness, and the doctors are of the opinion that the patient in its current illness, if everything takes its normal time, the patient will pass within the next 6 months. Now, this is something that, here, talking to you is easy for me to say, but when I'm standing in front of a family, when I do a hospice consult or it's kind of difficult because imagine I'm talking to people that are learning, and sometimes for the first time, that their loved one have 6 months or less to live. And that's why I say that a lot of doctors do not understand hospice. They're uncomfortable because it is an uncomfortable conversation to have. So they're uncomfortable to talking about it. So the easiest way to go is to write an order for hospice and let the hospice agency handle it. So I go in there with the knowledge that most likely the patient and their family do not know what's going on. So the way that I operate, I go in there and I obviously I do some fact finding from the doctor or the case manager at the hospital, and I try to see if they really had the conversation or not. When they tell me that, oh, well, no, that's what you're supposed to do or something like that, then it becomes a little bit more difficult. So I start by telling them that hospice, one of the easiest ways to do it is to compare hospice to home health, because most patients have been in home health, they're more familiar with home health services. So in home health services, we provide them with nurses, nurses assistants, therapists, and sometimes with social workers. But if they need medical equipment, we have to go through their doctors. If they need medications, they got to go through the doctor and get it from the pharmacy. If they need medical supplies, they have to probably, in most cases, pay it out of their own pockets. So that's a big difference. Now, the only similarities are that we're going to provide them a nurse, like in home health, a CNA or a nurse's assistant, and then therapy if they need it. But in most cases, they don't ask for therapy when a patient only have a short time left to live. However, in hospice, in addition to the basic clinical services, we're going to provide them with a visiting doctor, with a chaplain, and with a social worker. And I'll explain the role of each of those as we go along. However, when it comes to medical equipment, from a hospital bed to a Hoyer lift, bedside commode, shower chair, whatever the patient happens to need as far as medical equipment, we're going to provide it for them with no red tape or no doctor's orders or nothing. At the beginning, the first consult I do with them, I take a list of what they need. I will also ask them what kind of medical supplies they need, and there you're talking about paper products, say diapers, wipes, gloves, lotion, and those supplies that will make the patient more comfortable, and importantly, those are very expensive supplies. If you check the price of diapers lately, it's very expensive. They're very expensive. And then the medications. So any medication that has to do with the hospice care, and in hospice, basically, are going to be medications that have to do with the pain and the side effects of pain management. So those are constipation, nausea, anxiety, and most of the medications that we provide for hospice are in that realm. Those are the medications that we're going to provide them. However, because they are in hospice doesn't mean that they got to stop taking the medications that they're presently taking. They can continue to take those medications, which is a big, big myth. People think that when somebody goes into hospice, the hospice doctor is going to tell you to stop taking all the medications you take. That is not true. The only thing that cannot continue is any aggressive treatment that you might be receiving or that the patient might be receiving. For instance, if the patient is receiving dialysis, they have to choose whether to continue with the dialysis or to go with hospice. So if the patient decides, no, I don't want to stop dialysis, because once they stop dialysis, they're going to live somewhat between 2 and 4 weeks. So it's really the patient is making a decision that, hey, I know I'm going to die soon, but the suffering is too much. Let's go ahead and do it. So most patients with dialysis have a hard time making that decision, and I don't blame them, because after all, our main or first instinct is to stay alive. It's the instinct of preservation. So other examples are people who are using a respirator, because in hospice they will have to stop using a respirator. And chemotherapy, the same. You will have to stop your chemotherapy or your radiation treatment for cancer. So in the case of the dialysis and the respirator, that's where we receive the most resistance from the patients or their families, but that's fine with us, because we can always help them with the home health. And that is the advantage that Avatar Home Health and Hospice, one of the advantages that we have over many agencies. So we can have a patient in hospice, and let's say the patient doesn't decline, and we can put them back in home health. We have a patient in home health, the patient starts declining, then we can transfer him to hospice. And all without changing the nurses or the nurse's assistant or the therapist or any of the personnel at the office that they've been accustomed to deal with. So once we admit the patient in hospice, we start by training the caretaker, because that's important. Oh, excuse me, that wasn't supposed to happen, but when you're on live radio, this kind of accidents do happen, or in live television. So this is not supposed to happen, but I'm sorry, my apologies. So one of the things that we do, and then with all the gadgets that I have nowadays, everything is ringing at the same time. So my apologies. So the first thing that we have to do is to train the caretaker, and because the care in hospice, and I'm glad I mentioned that, because this brings me to another misconception about hospice. People think that because they're going to go into hospice, they're going to be put in a hospital or a nursing home or in some facility that they're going to give them the time to die alone. That's not the case. Hospice is designed for the patients to stay at home. So when Medicare approved hospice, the idea was not for the patient to be in a hospital or a nursing home. The idea was for the patient to be home, surrounded by those people that love him, by their relatives, and they have to provide a caretaker. So let's say before going into hospice, the wife or the husband was taking care of his or her spouse. That will continue to be like that. The difference is that now, with a hospice agency, like with Avatar, now we're going to provide them support. So that's something that in the past or even today, people think that, oh my goodness, I don't want my husband to be put in a nursing home, and I wanted it to be at home. So that is the idea behind hospice. So we have the training for them, and then our nurses are going to be there 2-3 times a week, depending on the necessity of the patient. And as the time goes by and the patient starts to decline, our services might increase if the patient needs it, or if the patient wants it, because sometimes the patients want to be left alone. So they say, well, only send the nurse once a week or only send the nurse once every 2 weeks. And that is fine with us. We work with the family and the patient to make sure that they're comfortable with what we're doing. Because after all, our main purpose is for that patient to be comfortable and pain-free. So we're not going to force the patient to do anything. Another misconception is that, oh, they're going to starve my husband, or they're going to starve my wife. That is not true. The patient, while in hospice, can eat whatever they want, as much as they want to, or as little as they want to. We don't get involved with that. Now, we do give them advice as to what kind of foods are more nutritional. If they have a history of high blood pressure, we have to tell them, of course, to lay off the salt. But that is only that's only because we have to do that. But if the patient doesn't want to follow our advice, that is okay. It's their life, and they can do, they basically, once they get into hospice, they can do whatever they want to do. So it is very important to establish a good communication with the caretaker, the family of the patient, and with the patient. So, so let's continue a little bit about the misconceptions of hospice. For instance, people say, well, I want to fight until the end. I don't want to give up. And really, the patient is not giving up at all. The patient is just continuing to live and choosing to live with some kind of freedom and the dignity to do what they want to do with the rest of the time they got left. We have patients that have gone into a cruise that they've been putting off for years because with all the doctor's appointments and all the medications and everything that they go through, they don't have the time to take a vacation. It's unbelievable. Sometimes, like for instance, in my case, sometimes I don't have time to take a vacation because I work a lot. But imagine that you cannot take a vacation because you're going to the doctor all the time. Some of our patients have appointments 2-3 times a week. And if not, they have to go to the lab to have blood drawn, and they have to go to x-rays or MRIs, you name it, they go through it. So in hospice, you get more time to enjoy your life with dignity and without the pain and without the side effects that a lot of the medications that you take are causing you. For instance, if you're going through chemo, I've never been through chemo. I never had, thank God, I never had to go through that. But my sister did. And believe me, it was very painful. It was very debilitating. And actually, it got to the point where she could not move her arms or her legs. So she laid in bed, and yeah, and it was. I don't want to go and get into detail because it was very sad. But she was in pain, and it took her a while to accept, because of all these misconceptions, that the fact that she needed hospice. And once hospice came in, and this was not, I wasn't able to help her because she lived in Austin and we were in Houston. But the agency helped her get through the last few weeks of her life. So the other one is that you're gonna die sooner if you go into hospice than if you stay with the treatment that you're getting. And that's another falsehood. People, everything being equal, let's say you have two patients with the same conditions, same age, everything the same. One chooses to be going to hospice, the other one chooses to continue the treatments, even though the doctors told them that the treatments weren't going to do any good. So the person that chose hospice is going to live an average of 15% longer than the person that chose to continue the treatment. So that's another myth that has been debunked. And the one that people are very fearful of, because they've been hit with all the doctor bills, hospital bills, medications, they don't ask, actually. I have to tell them up front, because they might not accept the services because they believe that it's going to be very expensive. Because after all, if I tell someone that we're going to provide the nurses, we're going to provide the home health aide, we're going to provide the visiting doctor, the social worker, the chaplain, we're going to provide you with all the medical equipment you need, all the medical supplies you need, all the medications you need, that person in his or her mind might be adding the dollars. And oh my God, $100, oh my God, this is going to cost us $5,000 a week. Well, 99% of our patients are either Medicare or Medicaid beneficiaries. And for those, there's no cost. There's no way that we can come back to a patient and say, listen, Medicare didn't pay us, so now you owe us this much money. If Medicare doesn't pay us, we have to simply eat it. We cannot go to the patient and ask him for any money. If Medicaid doesn't pay us, the same thing. We have to forget about it, and we cannot bother the patient with that. So it's almost unbelievable that the Medicare provides and Medicaid, they provide all these benefits at no cost, no co-payments, no deductibles, nothing. So I have spoken to you about the myth and how it basically, what I talked to the family about in the consult. So let's say that you say, well, Mr. Felix, I have my brother or my sister, whoever, a loved one that needs hospice. How do I go about getting hospice? So the way it starts is we're going to get an order from a doctor or a hospital telling us the patient needs hospice, that he or her has a life expectancy of 6 months or less. At that point, we check the insurance. We want to make sure the patient has Medicare or Medicaid, or if they have private insurance, that insurance company is going to pay for the hospice services. Then we make sure that we have the proper personnel available to take care of that patient. So most of the times, by the time we get a referral, we know that we can take care of the patient, and we just go through the exercise of making sure that we do. And after that, we have myself or one of my marketers or my hospice specialists, they will meet with the families and they will go through the initial consult. Now, sometimes the families are fully aware of what hospice is all about, so we can basically forego the initial consult. But in many other times, we do have to go and visit with them and explain to them what hospice is and make sure that we mention that it's not going to cost them anything. Then after that, the nurse goes over there, that goes to the patient's home, and she does the initial assessment, and then that initial assessment is sent to our medical director, who's a doctor, obviously, and that doctor is going to approve that the plan of care that the nurse is coming up with. And of course, we've been doing this we've been doing home health and caretaker services for 20 years. We've been doing hospice for about 18. So basically, we know what we need to do. The doctor approves it, and then we encourage the family not to call 911. If they have an emergency, they don't have to call 911 and get the patient into a hospital. If they call us, we send the nurse right away. We give the patient the we take care of the problem, whatever problem the patient might have. So again, this is a service of all the 3 services that we provide, which are home health, hospice, and caretaker services. Hospice is the one that is most dear to my heart. Why? Because we get the opportunity to help people in one of the most difficult situations that anybody is gonna face. And I put myself in their situation. Imagine, I lead a full life. I got a wife, a daughter, grandkids, great grandkids. And I go to the doctor because, whatever, my heart is, I have a pain in my chest or something. I say, oh my God, you have heart failure, and listen, you have about 6 months to live, or even a year, right? Can you imagine the shock that I will get? Then in the case of cancer patients, the doctors usually give the patients that are receiving chemo hope. They tell them, you have 70% to live, they give them percentages. But the person, like I said before, nobody wants to die, so you're always gonna hold on to that hope that you're gonna be one of those in the 70%. But then one day they tell you that, no, I'm sorry, you're one of the 30%, you're not gonna make it. So that's a shock. That's a shock not only for the patient, but for the family. And we get the opportunity to help the families on all the areas that they need help, in the clinical, in the emotional, and in the spiritual. So that's it's very hard to explain. It's one of the things that say, well, the feeling that I get or that we get, because the whole hospice department is the same way, the satisfaction that we get, even though when you lose the patient, it's very sad, because we develop a relationship with them and their families. So that is very painful for us, but at the same time, we feel blessed to be able to help people when they need it the most. And Avatar Home Health and Hospice, we do an extremely good job, and that is manifested by the comments that we get and the reviews that we get in not only in our webpage, but in Google. And we invite you to go into our webpage, which is avatarhomehealth.com, and look at not only at the history of the agency, but you're going to be able to click on some podcasts that we've done before, radio shows that we've done before, and look at the reviews. And of course, you're going to find some reviews of some employee that got fired or something, and they say something negative about the agency. But overwhelming, 99% of the comments are very positive, and I invite you to do that. So I'm very grateful and thankful that you have taken the time to listen to this video, to this podcast, and you can call me. I forgot to give you my phone number. My number is 281-703-8050. That is 281-703-8050. And that is the same phone that you heard ring before. That's my personal cell phone. So you don't have to call the switchboard and be put on hold forever and what have you. When you call me on the phone, I'm going to answer, except if I'm doing this. And next time I'll make sure that I don't bring it into the recording studio. But I always will return your call promptly, and I can answer any questions you might have about hospice, home health, caretaker services, and other insurances for Medicare beneficiaries, nursing homes and assisted living facilities, anything that has to do about taking care of seniors. After 20 years, I'm being a senior myself. Believe me, I'm an expert in them, and I'll be more than happy to help you with any needs that you might have. So please follow us up on us on Facebook and Indeed, LinkedIn, and all those different One of these days, I'm going to learn the name of all these social, all these platforms that we're on. But look us up and again, call me if you have any questions. Thank you.
Estas son las redes sociales oficiales de Aliento Radio: Facebook, Instagram, TikTok, LinkedIn, Twitter y YouTube. Encuéntranos como @Aliento Radio Oficial.